Welcome to our Mary Greeley Primetime Alive program, Exercise and Osteoporosis. I am Vicki Newell, and I manage the Primetime Alive program here at Mary Greeley Medical Center. As a reminder, if you would like more information about Primetime Alive or to sign up for any other upcoming programs, please go to mgmc.org/PTA. Our presenters today are Karen Welk and Sarah Burns. Karen and Sarah are physical therapists who work for Mary Greeley in Story City. Karen has a doctorate of physical therapy from the University of St. Augustine, a master's of physical therapy from the University of Iowa, and a bachelor's degree in biology from the University of Northern Iowa. Sarah has a doctorate of physical therapy from the University of Iowa and a bachelor's degree in movement and exercise science from the University of Northern Iowa. Please welcome Karen. It looks like Sarah first. Sarah and Karen will be handing off the presentation responsibilities, and we'll start with Sarah.
Okay. Thanks for joining us. My name is Sarah, and I'm going to start by going over an overview of osteoporosis, and then my colleague Karen will come up and talk more specifically about exercise and osteoporosis. So I will start with just a few definitions. Osteoporosis is a disease characterized by low bone mass and the deterioration of bone tissue. This occurs when the creation of new bone doesn't keep up with the loss of old bone. This increases somebody's risk of fracturing, and osteoporosis is what's called a silent disease, so it doesn't have specific symptoms that tell you that you have it, unless you have a fracture or pain that's related to that. Osteopenia is low bone mass. This is not a disease, but it can lead to osteoporosis if the individual continues to lose bone density. Here is a visual representation of what happens to bones with low density. On the left, you can see a healthy bone, and it has a good structure to it. And then over on the right is a visual representation of an osteoporotic bone. You can see that there's much bigger gaps within the bone, making it a more fragile structure. And it's often described as porous, which is a way to help remember osteoporosis is a porous bone. Here are the risk factors for low bone mass and osteoporosis. The non-modifiable risk factors are gender. It's more common in females than males. Age, it increases as we age. White or Asian descent, somebody that has a condition that reduces the hormones in your body. Your body size, typically smaller frame individuals are at a greater risk. Thyroid conditions, a family history, that's actually one of the biggest risk factors. That contributes about 70% of your risk. And then a history of a previous fracture is another non-modifiable risk factor. The modifiable risk factors include low calcium intake, low vitamin D intake, estrogen deficiency, a lack of exercise, cigarette smoking, excessive alcohol intake, use of certain medications such as steroids, and prolonged use of a thyroid hormone. These modifiable risk factors are things that we can influence and change. Other populations that are at an increased risk of osteoporosis are those who have a history of abnormal eating behaviors or an eating disorder. And this can include anything from just prolonged use of restrictive dieting, fasting, diet pills, laxatives, diuretics, those types of things, or an actual diagnosed eating disorder. Also gastrointestinal disorders, or anything that makes the absorption of nutrients more difficult in your body. One thing to highlight here is that if you've had a gastric bypass, you've also decreased your ability to absorb certain nutrients, so that puts you at greater risk for osteoporosis. Menstrual dysfunction early in life may negatively impact your peak bone mass, which can increase your risk for osteoporosis. Also, early menopause leads to an earlier onset of bone loss in adulthood. Chronic liver disease, you have decreased absorption of vitamin D in that situation. That puts you at greater risk. And also cancers, specifically ones that metastasize to the bones, most commonly the prostate, lung, and breast cancers. Up until young adulthood, you form new bone faster than you lose old bone. Bone is a living tissue, so it's constantly adding and breaking down. So up to 90% of peak bone mass is actually acquired by the age of 18 in girls and 20 in boys. Achieving a greater peak bone mass at this age will increase the bank of calcium that you have, that your body can draw on throughout your life. And then we continue to increase our bone mass more slowly until the late 20s. At that point, your bones have reached their maximum strength and density. Bone mass stays relatively stable in women from age 30 to menopause, but in the first few years after menopause, most women go through a rapid bone loss, a withdrawal from this bone bank. And that slows but continues through the postmenopausal years. So bone mineral density testing uses x-rays to measure the amount of minerals in your bone, and that estimates the density. It records a T-score, and in this chart I have outlined those T-score results. So anything over -1 is considered normal bone density. -1 to -2.5 is considered low bone mass or osteopenia, and -2.5 and below is considered osteoporosis. And that will get a diagnosis of osteoporosis. So who should get tested? Women or men who have broken bones with or without a traumatic incident after the age of 50 should get tested. All women 65 and older, all men 70 and older, women younger than 65 who have reached menopause and have risk factors for osteoporosis, men age 50 to 69 with risk factors for osteoporosis. This chart shows the prevalence of osteoporosis in men, which is shown in the blue, and women, which is shown in the red, across the most affected age groups. So on the horizontal axis, it has years. So from 50 to 85. And it's pretty clear to see that risk increases with age pretty dramatically after the age of 50. And also it's pretty clear through this chart that the risk for women is greater than the risk for men. However, it is not a female-only disease. This affects males also. And you can see at age 85 plus, maybe. Now the cursor's not working. That's okay. At age 85 plus, the risk for men is about 50%. So 1 in 2 women and 1 in 4 men who are at least 50 years old will have an osteoporosis-related fracture during the remainder of their life. That's pretty significant. That's 50% of women and 25% of men over 50. So we're going to talk a little bit more about fractures next. The most common fracture site is the spine, the hip, and the wrist, but they also occur in the humerus, which is the upper arm bone, and the pelvis. Fractures can be devastating for an individual, and they often lead to decreased mobility and increased dependence on others. Most common osteoporotic fracture sites are, I already said that, sorry. Risk factors for fractures are low bone mass, a history of falls, low physical function level, impaired cognition, impaired vision, and previous fracture. Spinal fractures specifically can lead to issues with posture in individuals with osteoporosis. Posture affects all of the pressures through the spine. After one vertebral compression fracture, there is a higher risk of having a second within the year. And there's actually a cascade effect between posture and vertebral compression fractures. A fracture causes loss of height and decreased balance, which increases your fall risk. That causes more of a forward displacement of your center of gravity and increased flexion of your thoracic spine, as you can see in some of these pictures. And that causes higher loads on the anterior segments of your vertebra, which in turn increases your risk for fracture. So it's a bad cycle that we'd rather tackle before we have a compression fracture, and that's one of the things that Karen will be talking about specifically with exercises. So for management of low bone density in adults, this centers around the prevention of further bone density loss and the prevention of getting a diagnosis of osteoporosis. First of all, we can change certain modifiable risk factors like quitting smoking, also getting regular exercise, having a healthy diet, possibly including some supplementation of vitamins. In rare cases, you might need medication or hormone replacement to treat osteoporosis. And then make sure you get regular testing to monitor the bone density. And we are physical therapists, so we deal a lot with exercise specifically in the management of osteoporosis. So that's what we are focusing our presentation on. But if you have questions on these other management techniques, talk to your doctor. That brings up Karen.
Hello, my name's Karen, and I'm going to build on what Sarah has covered and talk more about some of the specific roles exercise can have in osteoporosis. First, I want to talk about how exercise affects our bones. Bones are a living tissue, and that means that they're always undergoing change. Older bone is removed and newer bone is added, and this happens throughout our lifetime. It's a process called remodeling. And when our bones are in a state of balance, it means that the amount of bone that is being removed equals the amount of bone that's being formed. When we're young and going through our growth spurt, we are said to be in a state of positive bone balance, and that just means that there's more bone being formed than what is being taken away. The opposite happens then as we age and get older. We actually shift into what's called a negative bone balance, where the amount of bone being removed from our bones is actually greater than the amount being formed. So why is this important? Well, it's important because exercise can influence our bone balance. It can help to decrease the amount of bone that is being lost and increase the amount of bone that is added. So that gets us to our sciencey definition here, Wolff's Law. And that just is a law that simply states that healthy bone will adapt based on the stress or demands placed on it. So if loading increases on the bone, our bones will become stronger to adapt to that stress and that load. So this concept is formational. Your body, in this case your bones, adapt and they get better with use. And that's a good thing. Next, I want to talk a little bit more about the amount of stimulus that it takes to actually help us build bone. The mechanism here is explained by what's called Frost's mechanostat theory. And I know that can sound scary and complicated, but it's really just a description of the science behind what we already know, that we have to do more than what we're used to gain strength or improve our endurance and to build bone. So the mechanostat theory says that there's a threshold that controls how much bone is added or removed. And in order to build more bone, we've got to get to dial things up a little bit to stimulate our body enough that it wakes up and says, hey, I need to lay down more bone. And this is described in this figure. It shows 3 colors, a red section, a yellow section, and a green section. And we're just going to briefly touch on the yellow and green. So the yellow section there shows what we would be like in our normal state. That normal state has an equal amount of bone being added and removed. And you can see across the top of that the line, the dotted line, is relatively horizontal. It's in balance. But if, say, we don't want to just be normal, we don't want to just maintain what we have, we want to increase our bone density, well, that's where we have to get past that threshold that's keeping us in the normal state and move us into the green state, shown by this upward curving line. The upward curving line indicates we're adding more bone than what we're removing. And in order to do that, what do we have to do? Well, we have to do more tomorrow than what we did today. So we have to maybe increase the loading we're doing in our bones. We might need to increase the number of minutes that we're doing our weight-bearing exercises. We might need to add some extra strengthening exercises. So the main point of this mechanostat theory is that we have to do more than our normal if we want our bones to get stronger. I want to take a step back and go back to our childhood and our teen years. And Sarah already talked about this a little bit, about the importance of this critical period during adolescence where we're laying down bone. We all know that what a growth spurt is. It's a time when our bones are growing rapidly, but not only are they growing in length, but they're also growing in density. So during those early adult years, teen years, we are actually laying down more bone than what we're losing, and we're in a state of positive bone balance. And it's a very important period of time because about a fourth of all of our adult bone mass is accrued in a 2-year period during our adolescence. This is called bone banking. It's a time period when we're laying down this bone and we're banking that all that extra bone density that we're adding to our bones is going to be there for us, and we're going to pull and draw from that bone for the rest of our adult years. So this period of positive bone balance occurs in adolescence, and as Sarah shared, it maybe peaks in our late teens, early 20s, maybe late 20s, early 30s for males. But there's basically a critical window of time that we need to accumulate this bone mass. Interestingly, it's not the same accumulation across all adolescents. Research is showing us that physically active adolescents actually have greater bone density than inactive adolescents of the same age. In fact, those that are active can have 40% greater bone mass than those who are inactive. So just an example that highlights the importance of building bone early and when we're young, and a great reason to maybe encourage your children or your grandchildren to be active. While starting with healthy bones is important, exercise in older adult years can also help us maintain and improve our bone health. Exercise is recommended for all people, including those with osteopenia, osteoporosis, and even those who have a fracture of their hip or spine. In our work as physical therapists and healthcare providers, we tend to focus on 3 different levels of prevention, and they're called primary, secondary, and tertiary prevention. Primary prevention refers to strategies used to avoid or delay problems with osteoporosis. In primary prevention, we talk about educating individuals on the importance of exercise and addressing some of those modifiable risk factors that Sarah mentioned. So this talk here is an example of primary prevention. Secondary prevention refers to interventions used early to reverse or even maintain our bone density. And we're going to talk about some of those specific exercise interventions in this talk. Finally, tertiary prevention refers to programs that help people who've already had a fracture. For these individuals, exercise can help restore their function and prevent further decline. Research shows that persons who've had a hip fracture, if they involve themselves in a structured exercise program, their risks of having a second fracture are much lower, and their function is greater than someone who doesn't participate in a structured exercise program. These people find that they can get up out of chairs easier, they walk at a faster speed, and find it easier to climb stairs. So the point here is that it's never too late to start an exercise program. Before I launch into talking more about exercises, I just want to make a little disclaimer and a word of caution. The information that we're sharing here today is just general advice. It's not meant to be an individualized recommendation for any one person. So if you have concerns about your bone health or other medical problems, it's always good to talk to your medical provider first before starting a new exercise program. And when you do exercise, start slowly and progress in small incremental ways so that you avoid injury. Listen to your body. That's maybe one of the most important things. If exercise is hurting, stop. There's something wrong. So I just want to touch on a few general principles of exercise. You may have covered these in some other prime time talks, but I want to speak to how they're important to osteoporosis. So these are general exercise principles. The first is specificity. This principle refers to the idea that exercise should target a specific area of the body where you want increased bone strength. So in osteoporosis, you should pick exercises that are going to target those areas where fractures are most common: the wrist and forearms, the hips, and the back. Overload means that you need to do more than the average amount of activity to stimulate the body to get stronger. And we talked about this with the mechanostat theory. Reversibility. This principle tells us that we got to stick with our exercise program. We all know the saying, use it or lose it, and it's true. If you don't continue with your exercise program, your body will start to revert back and you'll lose the adaptations that you worked so hard to gain. And the final one down here, initial values. This just refers to the fact that those who are more deconditioned, maybe their strength isn't as good, their endurance isn't as high, or their bone mineral density is lowest, they actually have the most to gain from starting an exercise program. Research shows that improvements are more significant when you first begin a new exercise program. So I'm hoping that maybe that motivates you to consider starting exercise program or start some new habits if that's not part of your lifestyle. Eventually, these improvements do start to taper off and you reach kind of a ceiling where there aren't as many improvements. But there's things you can do to tweak your routine to help continue to make progress. But until then, I hope you enjoyed seeing those improvements. So what specific exercise parameters influence bone density? We're talking about osteoporosis here. The 4 best exercise parameters for building stronger bones are things you probably already heard about. Weight-bearing exercises, exercises that load the bones, resistance exercises, exercises that require the joints to move through a range of motion against a resistance. This is the action of muscles pulling on the bones that helps the bones to get stronger. And finally, dynamic and variable exercises, meaning you got to get up and move around. We're not going to build our bone strength up by sitting on a couch. It also means that you need to change your routine from time to time. Our bodies get used to things. And so in order to keep progressing and gaining bone strength, we need to change our routine up a little bit to help our body keep adapting. So the next question is, what types of exercises are important? Well, studies will show us over and over again that it's actually a combination of exercises that makes the biggest difference in reducing both our risk of having a fracture and slowing down the loss of bone mineral density in our hips and in our back. This combination of exercise should include each of the 4 types of exercises I've listed up above here: muscle strengthening exercises, postural exercises, balance exercises, and aerobic activity. And we're going to talk about each of these in a little more detail. So resistance training focuses on strengthening our muscles. As I mentioned before, the muscles pull on our bones, and that in turn helps to strengthen the bones right where that muscle attaches. What types of resistance should be used? You can use just about anything. You can use weight machines, dumbbells, elastic bands, your body weight, doing calisthenics counts. Which muscles should be targeted? Well, you can't go wrong by exercising any of the major muscle groups in the body. But in terms of osteoporosis, think about 2 major problems. One is having a fall and having a fracture. So it's a good idea to work on strengthening the muscles of the legs and hips to help with fall prevention. Second area of concern for osteoporosis is the bone mineral density in the spine. So exercises to help with osteoporosis should also include those that target our core and our back extensor muscles. Posture is also important. Poor posture is associated with a number of risks, and Sarah talked about that earlier. Some of those risks include spine fractures, back pain, balance issues, and even trouble breathing, because that forward stoop posture can put some compression on your rib cage and lungs. Well, fortunately, there are a number of ways to improve our posture, and we can do that with exercise as well as body awareness activities. So I'd like to highlight a few of them. First, we can work to strengthen our core and our back muscles. The stronger our back muscles are, the less likely we are going to be stooped over in that forward position. We can also work on flexibility exercises. That helps to reduce the stiffness of our spine so that we can stand up straight and bring our shoulders back. And finally, we can work to improve postural awareness, reminding ourselves to sit and stand straighter throughout the day. One idea for improving your postural awareness is just to take your phone or a kitchen timer and set it to go off every 30 minutes. And when that timer goes off, that's your reminder to sit up straighter, stand taller. Balance exercises are also important for reducing the risk of falls. Again, the best balance programs are those that incorporate multiple components of exercise, activities that improve your strength, your balance, your agility, and your body awareness. And this in itself could be a talk for another prime time alive. So I'm not going to touch that anymore, but balance exercises are important. Aerobic exercises are a foundation for health and included in most exercise programs. However, I think you guys probably all know that all aerobic exercises aren't as good for bone building. Ideally, you want to do aerobic exercises that are in a weight-bearing position. That means on your feet, where the bones are being loaded. Aerobic exercise can also be further categorized by the amount of impact. Obviously, those who have risks for fractures shouldn't be doing high-impact exercises. But if your risks are low, then a low to moderate impact aerobic exercise might be the ticket for you. Swimming and biking are great examples of aerobic exercises, but they aren't as well suited for building bone just because they're lacking that component of weight bearing. But they do provide other important health benefits. So I've shared a number of different types of exercises with you. Now I just want to share some do's and don'ts. So I'm going to start with the do's. Do strengthen your back. Do include some balance exercises in your weekly routine, and do keep a neutral spine. By that, I mean one where the spine is relatively straight, or at least it maintains the gentle curves that are part of the spine. You can see this picture here of a woman doing a hip hinge. This might be something you need to work on one-on-one with a personal trainer or your physical therapist to help you learn how to do it correctly. But it's the idea that you're bending forward through the hips and not your back. You can use a dowel rod down your back, or just imagine you have a stick extending from your head to your tailbone, and you're going to try to bend forward, keeping that stick in contact with your back. If you can do that, then you know you're bending through the hips and you're protecting your spine. There are some things you should avoid, or at least be careful of, depending on your bone mineral density and your health status. So there's a term called contraindicated exercises. So contraindicated exercises are basically movements or activities that may not be suitable or advised for an individual because of the risks they might cause for a fracture. So what works for a majority of people in a group exercise class may not be a good choice for an individual based on their own unique health issues and needs. So basically, you should know your own personal risks. It might be a good idea to have your bone mineral density measured before you start an exercise program, or at least consult with your doctor or healthcare provider if you have concerns about your skeletal health. For those with osteoporosis and osteopenia, there are 3 things that I can tell you should probably avoid. And that is flexion, meaning bending forward at the waist. And you can see here that she's almost in the shape of a reverse C. So this C-shaped curve of the spine is what you really want to avoid. You also want to avoid twisting or making quick or abrupt movements because of the extra strain they can put on the spine. So I've told you that flexion exercises are bad. Now I want to show you why extension exercises are better. So this figure summarizes the result of what I think is kind of an eye-opening study. It compares 4 different types of exercise programs and the effect they had on influencing future fracture risk. So the study took a group of people who had already had one fracture in their spine, and then they divided those people up into 4 groups. They were followed over time, and then they tracked how many people went on to have another fracture of their spine. So of the 4 groups, group 1, shown by the blue bar here, well, they did flexion-based exercises. So that's exercises that made them bend forward at the waist. So you can think about those traditional good ab exercises, the sit-ups and the crunches. The second group, the yellow bar, was assigned to perform extension-based exercises. And by that, I mean exercises that targeted the back muscles. So to generalize, these exercises had people move the trunk in a backwards direction from a slightly forward position to a neutral spine or straight position. The third group, the gray bar, used a combination of flexion and extension exercises. And the fourth group, shown by the orange bar, they were the control group. They didn't do any exercise at all. So the most important point I want to make here with this study is basically shown in the results depicted in the figure. The participants who did the flexion-only exercises, the blue bar, they had the worst outcomes. 89% went on to have an additional fracture in their spine. They were actually worse off than the people who did no exercise at all, the orange bar. 67% of that group suffered an additional fracture. And then finally, notice that the participants who performed the extension-only exercises, the back exercises, are shown in the yellow bar. They had the fewest number of fractures, 16%. So the takeaway here is that flexion-based exercises appear to have an increased risk of additional spinal fractures, and extension-based exercises appear to be safer, but they're not without complete risk themselves. So how often and how much should you exercise in order to make that difference in your bones? Well, the table here lists the 4 main types of exercises that we've been talking about, and it provides recommendations about how often and how much you should do them. These are basically called the official U.S. Physical Activity Guidelines for Americans. The guidelines suggest that you should work on your balance and posture every day for 5 to 10 minutes, that you should strengthen your muscles 2 or more times a week in 1 to 2 sets of 10 to 12 repetitions, and you should perform aerobic exercise 3 or more times a week. Those same physical activity guidelines can be summed up in this chart. The advice in a nutshell is this: you should do 150 minutes of moderate intensity aerobic exercise every week. So that amounts to about 30 minutes of aerobic exercise 5 days a week. And on top of that, you should do some muscle strengthening activities at least 2 times a week. Well, we've covered a lot here, so thanks for sticking with me. I just want to share now a few slides to show you some examples that I think of exercises that I think would be good for osteoporosis. So first, work on your posture. You can try sitting and standing tall with your shoulders back, your chest lifted, and your chin tucked inward. You can try resting for 10 minutes a day in yoga's corpse pose. You can keep working to make your back more flexible. You can lay down on a pool noodle on your back and try stretching against that. You can gently arch backwards while sitting in a chair. Just make sure that chair is maybe in front of a wall so you don't tip backwards. Strengthen your back muscles, the back extensors. We've already talked about how important this is with osteoporosis. Common extensor exercises might include leg lifts while you're laying on your stomach, Supermans, doing a flying pose over a ball, or bridging, which is lifting your buttocks up off the floor while you're laying on your back. There are many exercises that can be done to improve your balance. Some are done where you hold a static position, and others require that you maintain your balance while you're doing a moving task. So static balance exercises might include standing on one foot, standing heel to toe, maybe holding a yoga pose. Dynamic balance activities might include walking heel to toe, sidestepping, or even walking in a figure 8. Try turning your head while you're walking. Tai Chi is an excellent activity for balance, so I would also encourage you to maybe look for a Tai Chi class in your community or to find one that you can stream online. You can strengthen the muscles of your arms by using weights, resistance bands, your body weight, or weightlifting machines. Just remember as you're doing these exercises to try to keep that neutral posture of your spine. And your legs, they can be strengthened too by doing a lot of functional tasks, like maybe repeatedly standing up and down from a chair, stepping up and down on a step, raising up and down your tiptoes, or doing the clam exercise while laying on your side. So this brings us to the end of this exercise portion of our talk. And now I'm going to turn it back to Sarah, and she's going to share a few other important recommendations for fall prevention and use of good body mechanics.
Thank you. Like Karen said, I'm just going to wrap things up with a few final recommendations. So, more than 1/3 of US adults over the age of 65 fall each year, and over 90% of hip fractures in this population are caused from falls. And so I wanted to really touch on fall prevention because that is very important in this population of individuals who with low bone mass or osteoporosis. The CDC actually has a really good checklist that you can use inside your home to try to decrease any trip hazards or things that could potentially make you fall inside your home. I have the link listed here, but I also have it copied onto the next slide that you can look at. So I encourage you to take a look at that. In general, increasing your activity level safely will also help decrease your risk for falls. And then if you need, you might need to use an assisted device like a cane or walker if that's appropriate to decrease your risk. If you have any questions on fall prevention, or if you've had a fall and you want to know how to get how to decrease your fall risk, I highly recommend seeing a physical therapist for that, for specific balance training exercises. This is that checklist that I talked about, and it takes you through each room or kind of area of your house, and it gives you simple advice and simple recommendations to make it a safer environment, and by eliminating trip hazards, making sure you have good lighting, things like that. And then lastly, lifting mechanics is really important. This kind of goes with some of what Karen was talking about for exercises, but lifting weights is very helpful for bone density, but lifting incorrectly can increase your risk of injury, specifically those spinal compression fractures. So this diagram shows some good advice for lifting. First of all, plan it out. Don't go lifting a box if you have no idea how heavy it is. So make sure you know what you're lifting and if your body is capable of doing that lift. If not, ask for help. Get somebody else to lift it or share that task with somebody. Also having a wide base of support, bending at your knees, tightening your stomach muscle, and then lift with your legs. And if at all possible, keep that load close to your body and keep your back straight while you're lifting. In summary, remember that 1/2 of all women and 1/4 of all men who are 50 years old will have an osteoporotic related fracture sometime in the remainder of their life. You can make a difference on your bone health by strengthening your muscles and bones through exercise. Good exercises for osteoporosis are those that incorporate multiple exercise modalities, weight bearing, resistance, balance, and postural exercises. Fall prevention is extremely important for those with osteoporosis because weak bones are more liable to break. You can reduce your fall risk by keeping fit, working on balance exercises, removing hazards in the home, and using a cane, walking stick, or walker to keep yourself steady. Finally, if you have questions about exercise and osteoporosis, call your physical therapist. They can help you. Watching.
All right. Well, Karen and Sarah, thank you. Great presentation. As of right now, my understanding is we do not have any questions, but please feel free to pop those in as I kind of do our wrap up and we can jump back and do questions. Okay. So here we have a question. I'll read it. You guys can jump in. If you have to take thyroid hormone for the rest of your life due to low thyroid, how can that be modified?
It's a great question for your doctor, but from our perspective, you might not be able to change all of those things. If that medication or hormone is needed for a different reason, then that's something to chat with your doctor about, just to make sure that you're at the optimal level and make sure that you can maybe tackle some of the other modifiable risk factors to try to improve your bone health without changing that one. Bad.
Okay. All right. Well, we'll see if another question pops in there. All right. Well, again, thank you so much. Lots of great information. I would not be surprised if there weren't questions because you guys covered a lot and provide a lot of good information. So just want to remind everyone of our other upcoming Primetime Alive programs. We're on a little break here now till April. So Wednesday, April 13th, we have a program, Cancer Prevention Screenings. And then Thursday, April 14th, we have Using Social Media. Am I safe with my information? Again, those are both virtual programs, 2 p.m. You can find them at our website, mgmc.org/PTA. Thank you for joining us and have a great day, everyone.